So the 988 Suicide and Crisis Lifeline is a network of over 200 contact centers across the country, and they're all connected through the easy to remember 3-digit number that is 988. And the 988 transitioned to the number in July of 2022 and transitioned from the previous National Suicide Prevention Lifeline 1-800 number. And the whole goal is to make it more accessible to folks. So people can still use the 1-800 number, but it's all connected to the same network.
All calls, chats, and text messages. So there's a variety of ways that you can connect with someone, and what you talk about there will stay safe and confidential. You know, I'm starting to notice more and more awareness around it. You know, it's not just me and my small circle that's like 988. I'm seeing it all over the place, which is really encouraging. Hearing people just more casually speak about mental health has been really cool to watch happen over time. You know, I see even in the programs that are developing, the ways that we're connecting with other community members, I feel really hopeful about where we're headed and what mental health care is going to look like in the future, because I think that so many of those base things that we need, that foundation, is really being laid right now.
The goals for 988 are really ambitious. One of those being to create a more connected crisis system of care. And so in Kansas, what that looks like is aligning some of these initiatives, for example, the transition to mental health centers as a certified community behavioral health clinic, thinking about integrations with public safety so that people who reach out can be put back on the track towards a behavioral health response.
Our counselors are trained to kind of try and meet people where they're at, but ultimately, you know, we'll let you know that it's a safe and confidential space. We'll ask you to tell us a little bit about what's got you calling or texting today. We really try to allow space for people to tell us what's going on with them. We want to hear their story, because that can give us a lot of information that can help us, especially when we're, getting to safety planning and trying to help people stay safe. A lot of it is creating space. We listen non-judgmentally, but in addition to that, we can also do safety planning, both immediate safety and maybe some more longer term plans. And we can also connect people to resources. If they're looking for a therapist, or maybe even some other helplines that are more specific to a thing that they're dealing with in that moment, we can do things like that as well.
One of the common misconceptions is that, well, if I'm not experiencing suicidal thoughts, then is this the right support? And the answer is, it doesn't matter what crisis looks like for you, 988 can be a resource and can be a space for you to kind of talk through what you're experiencing and what your options are.
I have my own experiences with mental health issues, with suicide and things like that, and so this work is incredibly validating, both for the experiences that I've had in my life and rewarding in that I really feel like I'm giving back and I can be there for people in those really vulnerable moments in a way that others were there for me in my vulnerable moments. And I just kind of love being part of that full circle moment.
It's an honor to be able to provide support to people in their moments of need. So I think if there's anything I would impart on people, it's that you can reach out. This support is for you. Our counselors are really dedicated to providing non-judgmental and empathetic support. Whether you're struggling with thoughts of suicide or not, this is a resource that you can reach out to.
I think first and foremost, know that it's free, it's confidential, and it's 24/7.